Having a heart rate that is too slow, bradycardia, can mean inefficient pumping of the heart. Now, often when we have a slow heart rate or bradycardia, then it's easy to assume that you might have lightheadedness. You might even feel like you're going to pass out. Now, patients that are older and frailer don't always get these warning symptoms before it happens. They may also present with things that are alternative to lightheadedness or dizziness. They might actually get symptoms of heart failure, which might mean shortness of breath, less exertion tolerance, more difficulty walking, for example, or finding that now tasks that they're used to doing are more difficult. They might fatigue, they might get vague, they might have swelling in the legs or more shortness of breath. So bradycardia can present in other ways apart from dizziness or lightheadedness or even blackouts. And it's important to be mindful that heart failure may be one of those presentations. And if you're not sure if that's a factor and you're a healthcare provider, then sometimes doing Holter monitoring can be of assistance. I recently had a patient like this, and he presented with what appeared to be a too fast heart rate, and we gave him medication to slow that down. And whilst he was having monitoring, we discovered he went into complete heart block. And when I asked his daughter about this, she said, oh yes, at rehab, they'd been complaining that his heart rate was in the 40s and too slow, and they were a bit worried about that, felt that he should tell his doctor about it. So as it turns out, he needs a pacemaker to stop the too slow heart rate. And yes, he presented in heart failure rather than with dizziness, problems with swelling and fluid retention and shortness of breath. So in his case, he's going to need a pacemaker to stop him from going too slow, and then we'll be able to give him medications to stop him from going too fast. These will optimize his heart function and reduce the risk of ongoing problems with heart failure.